official from Florida finds it important to be at a gathering, to be on the board?
Because I do anything John asks me to do. Can I say that?
Me too.
And I'm ready.
Okay. So please tell me your name and title, and start with my name is.
Okay. My name is Celeste Phillip. I'm the State Surgeon General and Secretary for the Florida Department of Health.
Wonderful. Thank you for being here. In a nutshell, could you tell me what is the big benefit of the National Forum? What is the value that we get in getting everyone together at this forum?
The National Forum brings together a very unique set of partners that have common goals but come from different sectors. That partnership, that collaboration is key for us moving the needle on decreasing heart disease and stroke. I've been very impressed with conversations so far regarding all of the different components that are required when it comes to local leadership, making policy decisions to support good health, large hospital systems, payers that need to be a part of the larger system that is required for us to make sure we are supporting people being healthy. My background is in prevention, and when we look at what is needed to decrease the healthcare expenditures in this country, how we can make sure that children and young adults are remaining healthy for as long as possible, we have to start working together to look at how we design built environments, communities that allow for people to be healthy, where, as we say, the healthy choice is the easy choice.
That is wonderful. And so talking about this meeting, so this is your first meeting, and you're on the board. What would you tell others about the National Forum in talking about why it's important to be here, to come to this meeting?
The National Forum brings together many of the federal agencies that sometimes need outside groups to help give feedback regarding what is needed to implement policy, program changes based on best practices, as well as those that are at the front lines in local communities that, again, all of us working together, it takes that comprehensive approach. In many other settings, sometimes there's more of a siloed approach, but at this meeting we've heard speakers on the panels address workforce needs, the importance of understanding where people are coming from, what is important to them, what are their motivators to become healthy. That is not always focused on in other settings, I would say. So I think that is some of the value of what the National Forum brings to this work.
Wonderful. I just wanted to ask one last thing about the report that came out today at the meeting, and it shows that the rates of heart disease are not going in they're leveling off, they're not going where we need them to go, and I think that is a prime example of why we all need to come together at a place like this. And what, as somebody who is from a State Department in Florida, what can you take home to Florida to push that needle in the right direction?
Heart disease remains one of the top 2 causes of death in Florida, depending on what year you look at. I am hopeful that the data from 2015 was just a small blip, and that we will see that we are returning back to the progress that we've experienced over the last several years. We know that the increasing obesity and chronic disease that we see developing in children is certainly concerning and playing a role. I hope this reminds us all of how important this work is, that we focus not only on adults, but as we say in public health, the whole lifespan, and renews our commitment to supporting health in children.
Great. That is perfect.
Okay, thank you.